Good day, global citizens. Welcome to another episode of Dr. Fajembola'S Opinion. On this episode, I bring you a colleague. I guess we did West African Institute of Public Health together. You were an intern.
Yes.
This should be the third or the fourth person I'm bringing from the West African Institute of Public Health. And I'm glad he's the person to take us through the topic for today, which is diarrheal diseases in Nigeria. Diarrhea is very common, and I'm sure I'm glad the aspects Mr. George is going to bring on diarrheal diseases on this discussion today. Please join me to welcome Mr. George Nsikakabasi. Hope I mispronounced your name well.
I'm actually really glad. I mean, like the way you actually pronounce Nsikakabasi. I mean, that's absolutely very good.
Thank you so much. When I see your name on social media, I'm like, actually, I don't call you George. It's Nsikakabasi. That's what is on my mind.
I mean, and it's actually my first name.
The longer one, actually, but that was on my mind because I'm a bit attracted to traditional names. So that's what actually is on my mind, not George or Samuel.
Yeah. I mean, Samuel is my dad's name and George is my surname. So I actually really love it. Like when people are able to pronounce my first name, like it gives me so much joy when someone says Nsikakabasi. I'm like, I mean, that's very good effort really putting in to pronounce this name.
Good effort. I understand. Let's take you audience through the profile of Mr. George. Mr. Nsikakabasi George is a dedicated public health expert with over 5 years of experience working across Africa, Europe, and Asia. With a strong public health strategy evaluation and implementation background, his work focuses on using data-driven evidence to address health disparities and improve access to essential health services for marginalized communities. He is an associate consultant with Swiss-based Acasus, where he strengthens HPV vaccination and routine immunization efforts. He also serves as the program lead for the ZeroNOMA Africa Initiative, an organization pushing to eradicate Noma, a devastating but preventable disease that affects thousands of children in Africa. He has a robust academic foundation and was a recipient of the prestigious Erasmus Mundus Excellence Scholarship Award. He has developed and applied skills in various local international organizations and UN agencies. This is beautiful. Actually, if you're not following after this episode, I feel Mr. George is one of the people you should be following on LinkedIn if you're active on LinkedIn. He always showcases his work, which inspires, to me, is inspiring, which inspires public health professionals. Mr. George, well done on your work across different continents on public health. How do you feel? How does it make you feel? The impact you're doing and your growth as should I say a young or mid-career professional?
Okay, well, so I've actually been really drawn to public health, and I think just to give a spoiler, I remember when I first took the form to apply for to get into university. I remember I was indecisive of what I was gonna choose. And I remember one of my uncles at the time was like, oh, there's this course called public health. And I was like, okay, so what about it? He just said, you're going to travel a lot. That was just the thing that just sold me to public health. But I think looking at that, that journey, from that time until now, and I think the work that I've been able to do have also spoken for itself, where I have, found myself and been able to contribute meaningfully to public health, whether it was in Nigeria, whether it was in Europe, or whether it was in Asia. Just doing a couple of things around policy, around programs, implementation. It's really been beautiful. I think I would always tell my friends that even if I was to die today, of course, which I'm not going to die today, that I would still feel very fulfilled that because of some of the work I have done, I would say children have actually had access to essential medicines, essential healthcare. I would also look back and see that, okay, the girls in Sokoto, really did have access to HPV vaccines, or children in places where they would otherwise not have, like received healthcare, because of the effort which I've put in, and also in collaboration with other professionals have really helped to push the needle and help these guys receive healthcare services. And I think I'm also really overjoyed, like when I also get feedbacks, from people, I like, oh, the work you do is very inspiring, and they see that it actually motivates them to do more. I see, of course, other young meet professionals like myself say that, and it's really just beautiful, and it just gives me so much joy, and also hope for the future that, well, things can be bad, but things can also be better at the same time.
Thank you so much for taking us through that beautiful explanation. Let's briefly take a look at what global citizens are saying about diarrhea diseases.
Yeah.
Normally, we get it from across the world, not only in Nigeria. The first is from Tempo, where he or she said, in 1994, India was consumed by plague. In 2006, by dengue outbreak. 2006 again by H5N1 outbreak. 2009 by Indian swine flu. 2021 by Nipah virus. India leads the world in diarrheal disease fatalities. Number 2 ranked dirtiest country worldwide. AIDS came from HIV which is from Africa. Wash your nasty hands. I guess it's just trying to explain like the recurrent outbreaks and diseases India has faced, and try to connect sanitation-wise diarrhea diseases, especially in India. The second tweet is from Lama of God, where he or she said, according to UNICEF, WHO, and the Global Burden of Disease Study, the top causes of child mortality worldwide in recent years have been prematurity, pneumonia, diarrhea disease, malaria, birth complications, malnutrition. This accounts for millions of deaths. And I guess it's right, because diarrhea disease is the third, as highlighted in your paper, third cause of deaths in children globally. Then the last tweet is from Get to the Chopper. I intentionally got this tweet, where he or she said the ones that use their hands to eat the most have the highest diarrhea disease death rates. I don't think it's true, because I use hands to eat a lot. In fact, my spouse was saying it yesterday. I was eating rice, and I was using my hand to eat, and it was like he saw someone that was eating somewhere, and the person was hiding because they were eating with their hand. Like, he was like, why are you ashamed of eating with your hands? And I feel eating with hands, we attach so much stigma around eating with hands. The current to-be mayor of New York, Mamdani, one of the points I was used to criticize him during the campaign period was like, how can a future mayor of New York, eat with his hands? Like, it's barbaric. And people forget that people eat pizza with their hands. People eat fries with their hands. Like, when we say eating with hands, people just attach it to a specific kind of food, like local food. Why? Countries.
Exactly, I get that.
Wings. People are licking the sauces from the wings with their hands. So I don't know the kind of, I don't know how we are trying to show that we are different, special from others. So the last I don't agree with it too, that eating with hands increases diarrhea as long as your hands are washed. There should be no problem. So now let's go to dive into the discussion we have for today. Mr. George, the audience, get ready for this discussion, because I intentionally did not make it about what our daily discussion of diarrhea diseases. But when you say diarrhea diseases, some people, what they don't know is diarrhea. And if you have diarrhea, like, you are stooling, you understand. And diarrhea, for medical wise, is when you have soft stool more than 3 times a day. Mr. George, what are these diarrheal diseases? When you say diarrhea, someone's very confused. What people are used to is diarrhea. So people are like, what is diarrhea diseases?
All right. So thank you so much. I think I just before I answer that, I really just love, I mean, what you said about India. I'm someone that really love the Asian continent a lot. I mean, I lived there, and it's one of these places that gives me so much very good memories. I ate a lot with my hands when I was in Malaysia. That's of course a spoiler. And I think it's just also beautiful, like what you just said, about okay, if you eat, I mean, with your hands, you're not gonna have the disease more. But I think this is really just the myth, that are just associated, like with diarrheal diseases. Usually it's just very important to actually see like what are, I mean, the main risk factors, first of all, like of this disease. Of course, we know that poor water, sanitation, and hygiene is a very big thing. So it is not in the using of your hands, to eat that is the problem. But just as you said, like, are you actually eating with clean hands? The food, like the way it was prepared. I mean, was it actually in a very sanitary condition? That things like that. Now, you also maybe consider like other risk factors. Let's say, for instance, malnutrition, which is something that is very predominant, let's say, in a couple of countries in the global south. And, one thing with malnutrition, mostly you would see them in children, let's say that below the age of 5, right? And usually when a child, has malnutrition, maybe wasting, stunting, underweight, this disease, I mean, this particular condition already weakens their immunity. So there are things in which the body would naturally, I mean, just help you protect. I love this theory very much. When I was back in medical school, where they would always say that, everyone walking actually has TB. But the only issue, or the beautiful thing, is that your body actually prevents you or protects you from having it, because you're not at the point where your immunity is really low for you to actually see that manifest. So if, let's say, a child is already malnourished, that already weakens that child's immunity, and that child becomes much more susceptible, to whatever bacteria or viral infections they are, to really manifest. And then let's also see something like low exclusive breastfeeding rate, and then also a couple of other environmental factors. For instance, you talked about eating, right? So if you're eating in an environment that is actually really dirty, let's say, there's also the big issue with open defecation, right? So if, for instance, you're in that kind of place, it's not even in you eating, but it's actually in, the pathogens and all of the organisms just moving around. You're eating this food, and then there's a fly, that perches on something and then takes that to the food that you're eating. So you would definitely be susceptible to getting that disease, even if you're using a spoon to eat that food. Even if you're using whatever you're using to eat the food, you would still definitely come down with that disease. And again, we also look at the health systems factor, associated with that. But then before I go into that, maybe I'll just answer your question around diarrheal disease. Diarrheal disease, from the definition from the World Health Organization and also from the IHME, that's Institute for Health Metrics and Evaluation, which actually produces the global burden of disease. So we just classify diarrheal diseases as, so it's an infection of the intestinal tract, and where it actually causes the passage of 3 or more loose stools. So there are a couple of things that causes it. So some of them are actually viral, some are bacterial, some are parasitic infections, and usually they are transmitted through contaminated water, food, or poor hygiene. And the very clear manifestation, of these diarrheal diseases, which can include dysentery, cholera, and many others, usually is going to result in dehydration, because you're actually losing electrolytes, right, like from your body. So in most cases, malnutrition, in most cases, shock, and even in very severe cases, death. And usually this is very predominant among children under 5 years of age. And so that now leads me to the point on the system level factors, which really makes this diarrheal burden really high. And one of them is really much access to care. In Kano, before I left Nigeria in 2020, between 2021 and 2022, I was working on a project, and this project was actually focused on strengthening zinc and LORS uptake in northern Nigeria for diarrhea treatment. So that project was really focused on ensuring that, zinc, LORS, ORS were actually made available, across different health facilities. And usually you would maybe, for instance, go to a health facility, that, let's say, a child is actually having diarrhea at the time, but they don't even have, ORS, they don't even have, basic things like that they can actually even use to ensure that this child retains his electrolyte in the body and doesn't really lose so much of this fluid. So that's now the part, because that's a part on the health system. So limited access, I would say, to treatment is really a big challenge in the global south.
Thank you so much for that elaborate beginning, Mr. George. Which takes us to the next question. What factors contribute to diarrhea diseases in Nigeria?
Yeah, so specific to Nigeria is not, I would say the risk factors in Nigeria would still also just be similar to what is going to be obtainable in other countries, let's say like India or Bangladesh, Pakistan, wherever. So, and they're just things which I had already earlier mentioned, like poor sanitation and hygiene. It's a very big one. And then also malnutrition, which of course weakens the immunity and increases the susceptibility, mostly of under 5 children. Again, is low exclusive breastfeeding rate. And usually I used to be that person that was like, oh, breastfeeding, right? But then you get to see that breast milk, it contains a lot of, like antibodies, and a couple of nutrients which are very necessary and needed for child survival, child growth, and all of that. And if a child actually really misses out on getting that, there's a lot of antibodies which would be needed for that child to fight off a lot of this infection before they even manifest. That wouldn't be there. So low exclusive breastfeeding, I think it's also a very key risk factor, right, for diarrheal disease, and especially in the Nigerian context. I'm looking at it again. The bigger one is, of course, environmental factors. There's open defecation, there's air pollution, and then lastly would still just be the health system factor, which I mentioned, where people are not having access to the care they need, especially for diarrhea treatment.
Thank you so much for that, Mr. George. We cannot erase the fact that water, sanitation, hygiene is still a big problem in most communities across Nigeria, especially with more disasters happening, flooding, which increases famine, water scarcity, access to clean water.
Yeah.
Mr. George, sorry, now diving into job, now diving deep into the paper. You and other authors talked about disability adjusted life years.
Yeah.
Now, one thing which I usually tell the audience that they think it's only for them. Sometimes when I bring these researchers on, they are also teaching me because I also learn from their perspective.
Of course.
Mr. George, what should we know about the disability adjusted life years?
Okay. So before I go on to that question, there's actually something I really wanted to say, just drawing on the example of India, which you mentioned earlier, and then Nigeria. So when we also look at diarrheal diseases, if we look at the trend, because one of the things I love about the work that we do with the global burden of disease is to look at how things have progressed right over time. And what we've noticed is that from 1990, up till now, let's say 2025 or 2021, right, when myself and my colleague worked on this paper, you can see that there was things have really improved a lot, right? Like the death from diarrheal diseases, the burden of it, the incidence of it, prevalence of it, and now lastly, the disability adjusted life years, right? So disability adjusted life years. So I think just something to just speak out. It's a standard measure, right, in global health, which we use to quantify the overall disease burden. So if we want to say, okay, this disease affects people, so what's like a measure that we would use to actually quantify that? So usually the DAILYs is one of the standard measures that are being used. In a couple of countries, they also use QALYs, so which is the quality adjusted life years. So the QALYs is just an opposite of the DAILYs. So this one is focused on disability, that's death, and then on the other side is the quality of life. And for DAILYs, in short, there are two things that come to make it DAILYs. So it is a summation of both the years of life lost due to premature death, which we call YLL, and then you also have years lived with disabilities or illness. And maybe I'll just give like the distinction between these two. So for instance, let's say a standard measure that we use in health economics is that one is actually expected, quote unquote, to live up to 70 years, for instance. Now, if a child dies at 5, that child has lost 65 years of full functioning life that child should have lived up to, right? So that years that child has lost, which is 65, now represent years of life lost due to premature death. Do you get the concept? Now, on the other side, we have years lived with disability or illness. Now, if let's say I got sick with diarrhea and in 1 year, I'm not able to function optimally in the society. So so we now have years lived with disability are the years in which you lived with that particular disease. Now, usually there are chronic diseases like, let's say, for instance, maybe cancer, hypertension, and all these kind of diseases are diseases where you would usually have much more years lived with disability because they are diseases that you have them for a very long time. So you'll have much more years lived with disability. But a disease like diarrhea, you would have years of life lost due to premature death much more. Because if you have it, they're like very acute diseases. Like if you die, like you die just almost immediately. And the time span in which you have the disease is also very short, right? So these two concepts, right? Years of life lost on this side due to premature death, and then the years with disability or illness come together to give us dailies. And one daily actually represents one lost year of healthy life. So what we tend to do with dailies is, what are the years that you've lost that you were not healthy? Maybe you died before the time you should have died, or you were sick and then you were not able to function optimally in the society. And for diarrheal diseases, like from our study in 2021, and we could see that diarrheal disease accounted for over 10 million disability adjusted life years in Nigeria.
Wow.
Which that, beyond death, right, it actually also reduced productivity as well-being, and also economic output. So you can imagine, and again, most of this burden was really among children under the age of 5. So you can just imagine that if a child at 5 dies, let's say from diarrhea, they've lost 65 years, of their life. So now multiply that by the total number of children who died, from diarrheal disease in the whole country. That's massive.
Thank you so much for that. Thank you so much for explaining. Even though if our audience, if they don't go to your publication, which we really encourage people to go to the publication to read more, to understand more, even though if they don't go to the publication, they understand what disability adjusted life years is. And this is what we want: simplification of publications, and so that it affects the health literacy of global citizens positively. Mr. George, what can relevant stakeholders do to erase the diarrheal diseases from the health sector? Is it erasable completely? And if it's erasable completely, what can relevant stakeholders do to erase it from the health sector?
Okay, so one thing I would say is, now you mentioned the health sector, but the health sector in itself doesn't work in isolation, right? Without other sectors, right? There's a lot of things. Health is one of the spaces that I really so love because of the interconnectedness, with other sectors. So if, for instance, let's talk about water, sanitation, and hygiene. These are things beyond the health sector, right? Let's say the way the health sector is actually structured. Let's say, for instance, in Nigeria or maybe in any other developing and developed country, there are a lot of other stakeholders that have to come in here. Let's say, for instance, in Nigeria, you have like the Ministry of maybe Water Resources. You're going to have like the Ministry of Environment and maybe any other, sector partners that would come there. And the very first thing I would say, like, to really erasing diarrheal disease, yes, I would say it's a disease that can be eliminated. They should actually be eliminated if we were able to fix the very basic problem, which is water, sanitation, and hygiene, and the environmental factors. So how do we improve access, right, to clean water? How do we improve access to sanitation? How do we also improve access to hygiene education? Now, this is also where the the education, like stakeholders now also coming, let's say like in our schools, so like what are the kind of communication, that are being given to like young people as they grow. I really use this example a lot of Japan. I know there was this World Cup game which they played, and then even though they lost that game, they stayed back and cleaned the whole stadium. And
Exactly.
again, like goes to show you
It
like,
was in Qatar.
things, right? And you can see like if these are things that we're so used to, right? Like from the education sector is really so very strong on this. Children or citizens are going to grow up, knowing the very core importance, of keeping the environment clean, and it's going to go a very long way. But again, it's one thing to have education; it's another thing to have the enabling environment for that to happen. Because if I have the education, but I don't also have access to water, I don't have an incinerator, there's still going to be a problem, right? So if we're able to fix that first, which again is going to draw on a lot of stakeholders, would be able to influence much in eliminating diarrheal disease. The second thing I would say is scaling up basic treatment like ORT and zinc, and just ensuring that these things are even made available. And I would say it's one thing, right, to have this. It's one thing to have an health system. It's another thing to know, are they actually even really functioning? So if, for instance, I come down with the disease, what is the very next thing that is available to me? Maybe in the health center that is there, in the pharmacy that is there, do I have access to actually getting this medication that would help me maybe not come down with this diarrhea, or actually to treat it almost immediately? So scaling up ORT, and I would say also strengthening our public health, our primary healthcare system. Usually that's the very first layer of care, right? So people don't really have to go to secondary care, but even at the primary levels, they are able to have treated this disease, or even eliminated them. Now, the core function as well of primary healthcare is also on education. So if this system and structure is already functioning, right, frontline healthcare workers would be able to, give the right information. Disease surveillance is going to also be like very strong as well. Improving nutrition, and again, nutrition it's also beyond health sector in a bit, because there's a lot of things there. There's agri, sustainable cities, you can think of them, climate change, a lot of things there. But if we're able to improve nutrition, knowing too well that malnutrition is a great risk factor, right, for diarrheal disease, I believe would be able to reduce the burden of diarrheal disease. And lastly, I would also speak to vaccination, right? So we know that diarrheal diseases, they are not just they're not just bacterial infections, as the case is. So one of the problems we're also even having now with diarrhea is that we have the whole concept of antimicrobial resistance, right? Because when maybe, for instance, a child comes down with diarrhea, the very first thing, let's say in a very Nigerian setting, I would want to go and take tetracycline or maybe any of these, antibiotics first of all. Right? And
Exactly.
now, if this was actually a viral one, it's definitely not going to treat that, right? So this is now the where, and from even current study from the GBD, I think it's going to be like the expanded one for 2023, majority of the diarrhea, of the cases of diarrhea have actually been from rotavirus, actually, and rota is virus. So this is now the place of vaccination. So are we expanding? Not Ampiclox now, because if it's still giving children Ampiclox, it's not going to treat or cure a diarrheal disease caused by rota. And now, how are we? If we ensure that rota vaccines are made available, cholera vaccines as well. Like there are also vaccines for cholera, OCV, and all of that. Especially in places where we know they are high risk for these diseases, it's going to really help us. And again, I would say so just to also just add one point would be risk communication, right? How are we communicating this? And this is something where I would speak to the place of science communication, right? You mentioned the whole thing with, explaining things to people for them to really understand the concept. And I think like with COVID, we really saw that even though there was a thing where there was a lot of evidence, But we also saw a very big problem with how the signs of COVID, or maybe the vaccines are actually communicated to people. So if we're able to strengthen risk communication, especially, as it regards like vaccine, like the signs of vaccine, rota vaccine, or maybe OCV, or even water sanitation and hygiene, ORT, zinc, and all of that, being able to work with like community structures to pass this information, I think would really go a long way in reducing the burden of diarrheal diseases.
Thank you so much for that, Mr. George. Actually, when you talk about Japan, one of the countries I feel they are clean again is Thailand. In Asia, yeah, some Asian countries are known for, and I'm not trying to compare countries. Some Asian countries are known for their very high percentage of cleanliness, and just from the way they are known to be clean, you can just know that they have low. I'm assuming they have low levels of infectious causes of diarrhea diseases compared to some countries. Yeah, they may have diarrhea disease to some levels, but we know we have the infectious cause and non-infectious cause of diarrhea diseases. So definitely countries like that, they have lower levels of infectious cause of diarrhea diseases. Now that takes us to the next question on still explaining the paper, the publication. From the publication, I quote, for sub-Saharan Africa, which Nigeria is part of sub-Saharan Africa, the value of one life year is equivalent to 4.2 times the per capita GDP at a 3% discount rate. Mr. George, this is one of the reasons people, you are laughing already. This is one of the reasons people don't read scientific publications. Even though if this is kind of easy, like one thing, if my audience, if you've noticed, I've not brought up statistics, outliers, mean median mode, and stuff of it. It's because that is not, I'm leaving that to the researchers who are giving that to you. But what we are taking is explaining the paper, like in ways that people can improve their knowledge on science, improve their knowledge on health literacy, improve their health, know what to do, what is happening in the world of health. So, Mr. George, I feel this is an important information, but for anyone who is not well learned and who wants to read more on diarrhea, this sentence might be hard for them to dissect. So what do you mean for sub-Saharan Africa? The value of one life here is equivalent to 4.2 times the per capita GDP of a 3% discount rate.
Okay. Yeah. Thank you. Thank you so much. So it's basically economic terms, but I'm just going to break it down. So what it simply means is now in health economics, right? So economics, really, we estimate, how much one healthy year of human life is worth. Now, remember when I was speaking to Dalis, right? I spoke about like Dalis being so almost equivalent to like one healthy life. Like year of life lost, right? So like one of that. So if a child is 5 and then that child dies at 5, right? That child has lost 65 years, right, like of that child's life. So what this value, this 4.2% means for low and middle income countries. Now, this is something that was developed by the Lancet and also by the World Bank, especially in sub-Saharan Africa. So the Lancet Commission recommends valuing each year of life, so at 4.2 times the GDP per capita, right? I think GDP is actually something that we can really understand. So it across different regions, right? Like they have like different numbers for it. But as pertaining to sub-Saharan Africa and also low and middle income countries, that number is 4.2 times. So what it means in practical terms is this. I'll give an instance. So if Nigeria's GDP per capita was like, let's say, $5,000, yeah, let's say 5,000 or 5,600 US dollars. Now, 1 year of healthy life year valued at 4.2, that amount. So it's going to be almost equals to about, let's say, 23,000 US dollars, right? So that means that's like the value of one life year that is lost.
Yeah.
Yeah, and so this just really, and why we have this whole concept here is really just to help us quantify, I mean, how costly preventable diseases are, like to really see the burden of this disease. And maybe I'll just also explain the 3% discount rate, and I'll use very simple terms. For instance, I want to give you money, right? I want to give you 1,000 pounds, right? And there's the option of me giving you that money in 10 years, and there's the option of me giving you that money now. So which one would you choose?
Now.
Okay, of course. So that's the thing. So the thing with discounting, really, discounting is like, there are actually things in the future, but would really always want to see either the benefits or the cost of those things now, right? So, and it's so in economics, the standard discount rate is 3%. So let's say there is also, like, for instance, this particular illness, right? You really want to account for what is going to really be the true cost of this illness, like maybe much more in the future. You really want to see, you don't want to look at it in the future, you really want to look at it right now. Like, what is the total cost going to be if we were to really do something about it, like right now, and channel so much, I mean, resources to it? What would that cost really look like? So that's the place of the discounting, the 3% discounting, for us to really see that cost. Okay, this is how much diarrheal diseases are really costing us in terms of life years, and it's also costing us in the economy, now using the GDP per capita. So with that, if we're able to bring an intervention that can reduce this by, let's say, 50, 20%, you know, what's that going to look like? So that's the whole concept. That's really the whole concept. It really just helps us to see how costly, how expensive are preventable diseases, and actually why we should invest in prevention, especially as it's going to lead us to having greater yields, in the health system.
Thank you so much for explaining that explicitly. I believe our audience understand. If they should go back to the paper and understand what you're trying to say. Yes, thank you so much for taking your time to explain that. I really value the way you are so interested, you're passionate about explaining the hard parts of the paper to us. There are facts and myths about diarrhea disease, and you mentioned it from the beginning of the discussion.
You also mentioned one as well. You mentioned one.
Yes, about diarrhea. Yes, about diarrhea disease. So what are key myths and facts? Because some people there are myths that they are thinking are facts. So what are key myths and facts about diarrheal diseases?
Okay, so the first one would just be what I had mentioned around that antibiotics are always just a go-to thing, right? Tetracycline and piclox as the cases. But just also realizing that not all diarrhea cases are actually from caused by bacteria, right? Most of the cases, as I said, as now is the case, actually caused by viral causes, which may not and would not also require antibiotics. And usually in those cases, you will just need ORT and also zinc to actually help to retain the electrolytes in the body. The second thing I would say is there's also this notion that, diarrhea is a normal part of, childhood, right? So any child, of course, it's just normal for children to have diarrhea, but that is really not the case. So diarrhea disease are actually preventable. In fact, there are cases where children don't even have diarrhea. And also, just to mention that it can also be fatal if untreated. If we just say that, it is a normal thing, right? A child can actually die from diarrhea, like children die from diarrhea. And we can also see that the burden is also really high. And also, there's usually the myth that it is usually either only just drinking water that causes diarrhea. I've also heard something like that. But again, we know as we've mentioned from the risk factor, that there are a couple of other things that contribute to diarrhea, and we can see that if the food that you eat is contaminated, if there's poor hygiene, it can also spread, from like person to person, and all of this modes of transmissions are equally as important as if you're only just drinking, water that is contaminated as well. So those would be the three myths and also the facts for diarrhea.
Thank you so much for explaining that. God bless Nigerian parents. I believe every Nigerian home that is out. I don't know in my home. Let me not generalize because I've made of living with people. But in my home, what is done is aside ORS, the salt and sugar solution prepared at home, and if you can do it in a clean way for the child or for whoever has diarrhea, it's really helpful because when an individual has diarrhea, you're losing fluids, which will become dehydrated. You're using electrolytes, which help you, which leads to dehydration. And with dehydration, it can, what are they calling it, lead to any fatal condition. So it's important, if you can get ORS as quickly as you can, please get ORS. You cannot get ORS, if you want to prepare locally, salt and sugar solution, as is usually called, you boil your water, make sure you have equal amount of, I've never prepared it, so I hope I'm saying it right. And they always prepared it for me. Sugar and salt solution, sugar and salt may be equal, or if it's not equal, you have to taste it if it's the right taste, and give it to whoever has diarrhea. It's really helpful and it helps them recover fast. So thank you so much for that, Mr. George. I hope my Nigerian people are not ashamed of me.
Well, I think you can just go with Nsikak for short. Nsikak is just very short. Nsikak.
Okay.
I hope that's not going to stress.
Not of the name. Okay. I'm not talking about the name. I'm talking ashamed of me of my
not
sugar solution prepared.
I got that.
So yes, and if you're watching this in the comment section, if I didn't get it right, you can put it the right way to prepare salt and sugar solution at home. Let's go to move to the next question. When I started the discussion, and when we started the discussion, I mean you discussed elaborately. You started it in a beautiful way, and I believe you've even tackled this question already. But let me just ask it: what things should we know about diarrhea disease in Nigeria?
Okay, so I would give I would say maybe 5 things. So one is that from the data, let's say as at 2021, that Nigeria still has about a 13% prevalence of diarrhea under 5 diarrheal diseases. But again, that number is really higher as you go up northern Nigeria. In Nigeria, diarrhea still remains one of the top 5 causes of death in the country, especially also for under 5 children. And from the result of our study, which again just corroborates that of the global burden of diseases, Nigeria actually diarrhea actually cost about 10 million disability adjusted life years. I pretty much hope that we kind of understand what disability adjusted life years is. 2021. The burden is actually massive. And when we also again, in the study, we had about three methods, right, which we actually used to value the burden of diarrheal disease. And we can see that from the Lancet method, which we used, which is the one that had the 4.2, where we actually multiply by 4.2 times the GDP and also discounted by 3%. Now, using that, we see that the economic burden of diarrhea is actually up to 35 trillion naira. Like, it actually costed Nigeria almost about 35 trillion naira, which is actually lost in the value of life, right? But the most interesting part of this whole conversation is that, which is now going to lead me to the 4th point, and again, it's just something I had mentioned earlier, is that the mortality from diarrhea has reduced significantly. From where we used to be in 1990 till now, it has really reduced. And again, thanks to so many effort that has really gone in, so many changes in the environment, so much focus again on in investment, like in early child survival. Again, like so much improvement, in our immunization systems, introduction of rota vaccines, and just so many things have gone into the Nigerian health system. You can even speak of the IMCI, the Integrated Management of Childhood Illnesses. That was also a very fantastic approach as well, which has also gone into the health system and has really helped us to reduce this burden. Notwithstanding, as we could still see from the 2021 study, the burden is still high, right? It's high. I mean, compared to like other diseases, and I would say this is strongly due to the water sanitation and hygiene challenges which we still have. Nigeria. But again, the other good news, which is the last point, is that most of these cases are preventable, right? And this is now the case with Nigeria, very preventable. If we make the key interventions, that are necessary available, like let's say ORS, zinc, people having, salt and sugar in their homes, and also improving sanitation. If we're able to fix and have all of these solutions ready at every time, would be able to have prevented diarrheal diseases and also reduce the burden really significantly in Nigeria. So that's my last point.
Thank you so much for elaborating what we should know about diarrhea diseases in Nigeria. Nigeria have been battling diarrhea diseases, outbreaks across decades. What has changed in the management of diarrhea diseases in previous decades, and where do you see Nigeria on the management continuum of diarrhea diseases in the next decade?
Okay, so I'll say first thing, there's been a huge improvement in child survival. I would say in 1990, a child was mostly very, very much likely to die before the age of 5, but that has really improved now. And I would say children would not really die that so much. Currently, let's say in 2025 or in 2021, at the time this study was done, as compared to 1990, we've also seen greater adoption of ORS, zinc, and also the IMCI. I am so very proud of like the work, which I supported in Kano State, again, which I mentioned at the very start. It was a collaboration between my organization at the time, the Wellbeing Foundation Africa. We did this work with Nutrition International and also with funding from the government of Canada. And it was fantastic, just making sure that these commodities like the zinc and ORS co-packs, were made available, and just also strengthening the drug revolving fund. So looking back at that now, like now that I'm back in Kano, I can see that, so much has actually improved, like the systems that we have put in place, ensuring that zinc and ORS were actually included in the essential medicine list, right? That has still continued. And we've also seen the push of that work to the other states, right? They've been that strong adoption of that. Beautiful thing as well that happened in Nigeria, as I mentioned, has been the introduction of the rota vaccine, which again is actually part of our EPI, right? The programs, and even in all of the campaigns that have happened, the SIAs. Even recently, we just had the MR vaccine introduction, which happened in Nigeria. And all through that introduction, we had routine immunizations integrated. So children still had the chance of getting, rota vaccine with other childhood, vaccines as well, even with HPV vaccines. And I think lastly on what has changed has also been better data, right? So the data currently, which we'll have at 2021, is actually much better than what we had in 1990, for instance. The routine surveillance systems has also improved so much. I also worked in surveillance, mostly on polio surveillance in Kano State. And we can see that things have so changed rapidly, even with COVID surveillance, with surveillance for diseases, cholera, meningitis as the cases. And that also just translates also onto for diarrheal disease as well, where we're able to track, okay, we see where there's an outbreak and then almost respond immediately. But where do I see us in the next decade? Rota vaccine coverage have it has actually improved, right, a lot from when it was introduced, and we can see this is also the start across all of the states, even though we know that, with COVID coming in, COVID really did stall routine immunization across almost all the world. But we are still seeing so much improvement now, as there's now a lot of investment, and commitment going into early childhood survival. I would also say strong community-led WASH initiatives. And the third point I would make here would be one which I'm very glad of and also happy for is integration, right? So where you're seeing integration between nutrition programs, health programs, immunization programs, like coming together. I think we could see that with even with the MR campaign, we can see that with the maternal, newborn and childhood weeks, which happen, where you can see all of this collaboration, so many diseases, partners, coming together. You can see NTDs, you can see immunization, all coming under one umbrella to ensure that people get integrated care. And there's also one collaboration I saw recently in Yobe State, which is called NutriVax. So it's the collaboration between nutrition and immunization. It was just incredible. And now knowing too well that malnutrition is a big risk factor, for diarrheal disease, when we're able to have these very strong collaborations, children on one side are able to get access to vaccines, rota vaccines. They're able to get so much nutrition support on that side. So this already drastically reduces the risk factors, right, for diarrheal diseases. And I would say lastly, it's just the shift. And where I'm seeing us again will just be the shift from just reactive treatment. So we just want to treat a child to really just strengthening, our surveillance system, strengthening our preventive systems to ensure that we are actually doing public health, right? Reaching larger population than just focusing on just one patient at a time. So, and hopefully, in the future, let's say in the next decade, we should have been able to have reduced diarrheal burden, hopefully by maybe a 50 to 70%. Well, if most of these conditions are actually put in place and sustained.
Thank you so much for that. Taking us through the management of diarrheal disease across decades. And this is one of the reasons I really bring researchers as guests on this platform, because this is something you can't get in the paper. It's great and it's refreshing to get the perspective from authors. So back into the paper now, another term, which the last term we want you to shed light on the cost of illness analysis. Okay. What should we take from this, Mr. George?
Okay, so cost of illness, the COI, as we call it, really just tells us how much a disease costs a society. So when you have a disease like diarrhea, so there are a couple of costs that are incurred in the process of one having that disease. And the way we look at it, it's usually beyond just the cost to the individual themselves. So we would have things like, and again, like in the paper, we had direct medical costs. So let's say you go to a hospital, right, to get diarrhea treatment. So the cost of you getting a car to actually getting the test and getting the drugs, all of that, those are direct medical costs, like you're paying them to get the treatment, right? Now, there are also costs which are direct, but they are non-medical costs. So the cost of you taking yourself to that hospital, the transport you pay, the food you pay, while you're there, all of those costs, right, that's still part of that disease. Because if you did not have those diseases, you would not have to incur those costs. Right. And then let's say, for instance, you had someone taking care of you. And now, very much in the Nigerian context, maybe if I have a sibling, my sibling may just, take care of me. But usually the way we look at things in health economics, we want to quantify, like what would actually be the cost of that person for going his work, to actually stay, take you to the hospital, take care of you. And now, don't forget that from Delhi's, we have years of life lost due to disability. So that time that you've actually lost in, you just being sick, this person is also losing his own valuable economic time that should have given to the economy. So all of those are now still part of the direct non-medical costs. Now, lastly, We have indirect costs. Now, these are costs that you as a person procure from that mobility. So if, for instance, I am sick, I don't have to go to work. That's a productivity loss, because that's a lost time to the economy. And the very last bit, which is usually not always accounted for, is the indirect cost due to death. Now, remember when we spoke about disability adjusted life years, we said there are two components. So there is the years of life lost due to death. So if you die, there's a cost of 65 years. For instance, if you die at 5, it's a cost of 65 years that you have really not actualized and really utilized. So, and that is a lost cost. And I really just love this one quote which I saw where someone said that, can you guess the richest place on earth? And people were like, oh, maybe it's Kuwait, in the oil wells in Kuwait or somewhere. Someone said, actually, the richest place on earth is the graveyard.
Exactly.
So much cost, so much lost opportunities. Actually, there's so much disability adjusted life years are just right there. So much potentials. A child would have grown to become whoever in the society and have contributed a whole lot. So all of that cost, we also tend to look at it as well in health economics. And for our study, when we did the cost of illness analysis, putting all of these costs together, and let me also just give the caveat that we only utilize cost from one study, which was done in northern Nigeria, which means that we did not also take into account maybe costs that may have been procured in private care. So private care would have maybe been much more expensive, or if that study was actually done in the south of Nigeria, for instance, it may have been much more expensive, right? So, but to give that caveat of things that we had to do, so we just only use just this one study. And from the cost of illness analysis, we see that in 2021, diarrheal diseases costed, the total cost of diarrheal disease in 2021 was about 109 billion naira. And if we disaggregate this cost by, direct medical, indirect costs, we could see that most of the costs actually came from death. And you can really understand why. So you had about 74% of that cost coming from early death, right? Like premature mortality. So which is going to be the part of the years of life lost due to premature mortality, right? So I would say the simple takeaway from the cost of illness analysis, or what we did, is just to show that preventing diarrheal disease, apparently, it's definitely be far cheaper than if we have to treat them, because this is just the cost of just getting treated for diarrheal disease. So if we're able to prevent that, I think would really drastically reduce the cost of treating it.
Thank you so much for giving us a thorough explanation of cost of illness with regards to diarrheal diseases. Now we can see that diarrheal diseases, they are like, it's multi-sectorial. Let me bring it. The Ministry of Agriculture, Ministry of Health, Ministry of Finance, Ministry of Education coming right in, and it also affects the GDP of every nation. And we can see Nigeria, you mentioned, is it 109 million?
109 billion.
Yeah, billion, not even million. Billion. I don't know what is the budget of Nigeria that we can afford.
Yeah, we are a rich country. We're actually a rich country.
Of course, we are a rich country. What is the annual budget of Nigeria for us to be able to afford 109 billion naira in annually? So thank you so much for explaining that, and we can see that diarrheal disease is not just a superficial condition that we can just discuss and ignore, that we can just ignore and put it that way. It's what affects every household, is what affects our economy, it's what affects every sector. And I'm glad to bring someone like you on board. That one thing is being on the host side, you can see when the researcher has passion, and when a researcher enjoys what is explaining or teaching or discussing. And this is a question. The next question is a question I rarely ask researchers. I only ask those who have been on the field and did the work firsthand. What challenges did you face during this research? Because you were in the community, right? And you saw this. What challenges did you face during this research?
So apparently, this the study basically, most of the data we got are publicly available data, right? Either data from the GBD or data from the International Labour Organization, that's the ILO, or even from the World Bank database, right? And I would say, and it's just something I just mentioned earlier, was just getting a cost, right? Like something that was done already, which was the caveat which I had mentioned, that at the time when we had done this study, the available cost of illness analysis which we used was apparently from the north of Nigeria. So, and we were not able to have made adjustments, let's say, for what would that have looked like, right? If we had done it like in the whole of Nigeria, maybe we had to do it like across like the different senatorial districts, right? Maybe like in the northwest, in the north central, in the south, to now put that cost together to really see, okay, this is apparently the true cost, right? Which would have given us like a national estimate. So I would say, just really being able to have gotten like that Nigeria specific data was really a challenge. And again, I would say something else to just also take into cognizance, especially like with regarding our estimation, is the confidence interval. So in the cost of illness analysis, and also maybe in the estimation of the disability adjusted life years, so because some of these data are iterations which are done, and you cannot really say, okay, for a certainty that, okay, so this is apparently what it looks like. So we just had to just work with the data which were actually available, and we also did not also do like maybe any kind of analysis or have maybe done like adjustment on that. And I would say lastly, yes, so this is the one I love so much. So when we explain the concept of disability adjusted life years, now remember, especially for the years of life lost due to disability or illness, there is the assumption there is usually that a worker, for instance, right, cannot be replaced. So let's say someone actually has this illness for like maybe 5 years. And the way we also did the data analysis, like especially for the cost of illness, we also use data from the ILO, where we're able to also see what is actually the minimum wage, right, for like males and females. So like we plotted that, like across different years, like did a couple of adjustments using the GBD deflectors to actually see what is actually the real true cost of if someone actually did not go to his work, right, because he had diarrhea, what is going to be the cost that person actually incurs. And it actually costed, so the adjustment was done on an individual basis. So which means that we also had the assumption that if someone is actually sick, that person is not replaced, which in one sense will say that assumption may have inflated the estimation which we made on the cost of illness analysis. So just the last bit there on the challenge is just the assumption we made in the mortality related productivity losses. But all the same, despite this limitation, I would say that this analysis, for me, and also for like the work I do, really just provides a clear policy signal, right? With the engagement that I've had so far with, let's say, the Sokoto State Ministry of Health, the Kano State Ministry of Health currently, it just still shows that, diarrheal disease impose an enormous and preventable burden, and we just have to prevent it. We just have to eliminate it.
Thank you so much for that, explaining that story to us. Global Citizens, during the week, we looked at Mr. George's paper on diarrheal diseases in Nigeria. It's an interesting paper, and more interesting this discussion we just had. Please don't add your knowledge. Share with your colleagues, share with your friends, because from this perspective, if you've been following our previous episodes, you know that from this the author's perspective is very different from reading the publication. So So thank you so much for joining us on this episode of Dr. Fajembola'S opinion. Mr. George, thank you so much for sharing your time, for sharing your expertise, for putting in the energy to explain to us and make it so simple. Like it's so simple when you explain it, it's simple because you know it. It's simple. Yes, and I'm glad our audience, like, they are eating good. I don't know if eating good is an acceptable formal word.
Well, it's
I'm glad
free.
our audience are eating good from this discussion. So thank you so much for spending your time with us today. Global citizens, do you know that this is a platform where research meets understanding and legacy? It's not just to understand, it is also to share it with others, share the knowledge we have, and also utilize for ourselves and be able to make informed decisions on our health, contribute to our communities health-wise. So have a blessed week, everyone. And don't forget, each one a one. Have a blessed week.
Thank
Thank
you so
you.
much for having me.